We're commenting on the cartoons.
But before that, please, that black image is not good.
The black image?
Black image, associating it with, what is that?
Coronavirus. The coronavirus.
So death is black, eh? We must move away from such images. Which paper is this? Which paper is this?
But it's always been depicted
Which
as black.
Which paper is this, please? I want to know.
This is the People Daily.
People Daily?
Yeah.
Stano is in with People Daily?
Yes, no, Stano is in People Daily.
Stano is with Nation.
No. We have Victor with Nation.
That's a bad symbol.
Black has always been associated, black market, you know.
Which is wrong.
Operation Black Hawk Down, you know, everything black.
Which is bad. We must walk away from that.
For us to have a black person there, and by the way, when you look at the features, it looks more black than anything else. Yes. And the coronavirus and our world economy, of course, that could be.
Okay.
Know,
that's black. Let's thank you, Haman, Farah, Gladys.
Yes, I was just hoping that by now we would have had a comprehensive statement from the Ministry of Health. The CS should be sitting together with the other members of their team,
yes,
just to tell us what protocols they have put in place to ensure that the virus does not spread should it come to Kenya. Mm-hmm. They should also be telling us exactly how we must behave. Like, I don't think Kenyans even know what the symptoms are. There should be a serious campaign explaining to Kenyans, if you feel this or that symptom, then you must go immediately to a hospital. Then they should say, within the hospital, you go to a certain desk immediately and not to the main casualty. Not to queue and spread. So we are completely ignorant as Kenyans. And if I'm not ignorant and I search for knowledge every day, then it's frightening what other position other people are in. And so I think they have failed us. The public health sector has failed us completely, because we should all know offhand. Step number 1, step number 2, this is what to do, this is where to go. These are the designated hospitals and dispensaries for people to go to. People should be told, if you have any member of a family arriving in from China, this is what you must look out for. In fact, they must report to a certain place. But if I look at, I was through the airport recently, and basically they said, write your name there. I wrote my name, and then somebody waved it. That
the scanner.
I don't think they even checked my temperature. So when it's so careless and they're not doing it, and as I'm saying, Kenyans, we lack a spirit of excellence and doing things with perfection to ensure that it can't move. And it's not because we don't have the correct health professionals here. We do. We are just being pedestrian in the manner that we undertake our work.
So we've not really had also from the
do you know, have you
public,
announced to the media yourself to say this is what you do? They've not given you a bulletin on exactly what to do. They should have been using every radio station, every media house to make an announcement. They should have been having it in the newspapers. They should be having it in all the vernacular stations, informing people so that Kenyans must say exactly what we should do. But right now we have no idea. We don't even know what the symptoms are, apart from a fever, which you can get when you have a flu, malaria, anything else.
Right. I would love you also to comment on how also we've been slow off the mark to evacuate some of the Kenyans who are still, in Wuhan right now, and they're calling on the government. I saw that plea from them, crying to the government to come and evacuate them.
Which is the other issue is, immediately the government should have known. We know how many Kenyans fly to, because it's recorded at the airport. We know how many Kenyans leave to go to China. It's one of the biggest trading partners of Kenya, next to Dubai. So we know exactly how many Kenyans have left. They should be telling us, as we speak, we have a head count of so many Kenyans who left between this date and this date into China. Right now, we have traced the number, how many have entered into the country. That information is at the Chinese authorities at the airport. They should be able to flag it out. All of it is digital and electronic, so that I can be, if I want to have confidence in my government, I want to hear them, and my Ministry of Health is to say, we know that we have 10,000 Kenyans who left between these dates. 8,000 have been accounted for. 2,000 we are still tracing. Any person who has a member who is going to China, please report to this number, or send a text message here. It is so easy to do it, but they are doing nothing.
That assumes you should be having an ambassador in China, and you don't.
We do.
These people you have are not ambassadors. These are people you pick who have failed elsewhere and throw them to be ambassadors. This is what will cost the country for not being serious, even in diplomatic postings. What will
happen is you may find a Kenyan.
But we've seen Sarah Sarem really also.
Those are people who are able to do certain jobs here.
When you make speeches and say everybody's okay, that is not taking action. Taking action is giving me specific figures and data. and giving us an exact format of how you're dealing with it. So that you're saying, because what will happen is that I can imagine most Kenyans who go to China are going to trade. Maybe someone has carried with them 500,000 shillings just to buy the goods. They barely have enough money for an extra day in a hotel room. That's the reality about the traders who go there, because they're small traders. So when they get there, if they feel the symptoms, believe me, if they know they can't support themselves in China, they will find all means to come back to Kenya and pretend they are not sick, because they are safer arriving home. So there's a real risk that even people, not because of any evil action they want to commit, but for their own survival, may enter the country despite being sick. So if they give the confidence to these people that we will take care of you as the embassy, we will manage you, so don't try and bring the virus into Kenya, we'll ensure that you get medical support wherever you are, then we are safe. But we are not safe if we have abandoned our own people, because then they'll take the matter into their own hands.
I want to add something to that. You remember what Speaker Faras Malem said? That you are an African in China, my friend. You have a problem. But can you imagine what Kenyans are? You are a Kenyan in which is called what? Wuhan and Guangzhou, whatever those areas are. And it is a dead city now. And it's not your country. And you can't even venture out. These people will die even from, not even that virus, they will just die. That feeling, it is a horrible state to be in as a human being. And that's why, much as I understand the challenges involved, much as I understand the government's position, I think something ought to be done. A human being should not be subject to that kind of state. It's a terrible state to be in, really. Being in a foreign country, you are a black, nobody respects a black person. The moment one of them, God forbid, I pray for them day and night. The moment one of them
becomes sick,
dies of that, the treatment the black men will get in that country, I'm telling you, my friend, that is why government must...
They just throw them all into...
Government must think. Honestly, government must think. This saying they are better off there than here, in my view, is not good. Government must think, because if 1, 2 of them die in China, black people, I'm telling you, they'll be subjected. They can even be killed before they die. I'm not saying they will do it, but that's how strongly I feel about it. I think government should engage with W.H.O., with other stakeholders, and find a way, like Shole is saying, of reaching these people. Even if there's a special plane with doctors flying it, there are doctors who can fly. They go and pick these people, take them somewhere special in this country, and let them be quarantined for even 1 month. They will be, that's how we should treat our citizens.
Right, thank you.
Americans will not allow their citizens. I think no country would put their citizens through that situation our Kenyans are in.
Right, thank you.
Yeah.
I
I think the only thing, you know, all these points being raised here, remember that virus has an incubation period of up to 2 weeks.
14 days,
yeah, up to 2 weeks. And I remember a friend of mine was telling me about 4 days ago that he had just received four Chinese contractors who had just flown in from China.
You see?
So
we are not
I
serious.
don't even know whether the government even keeps a record of the addresses where these people end up staying, whether we do a follow-up, whether we
still coming in.
even you know, condition them to make reports to certain places within a certain period of time, so that we are able to monitor. And I think Dibal really, not in bad faith, but as a precautionary measure, I think our government needs to ban non-Kenyans arriving from China.
The Kenyans to put them in quarantine.
Yeah, I mean, because other countries are doing it. I've told you that the Australians have done it, the Americans have done it.
People on quarantine.
Yeah, and quarantine.
But
so
even China is taking very serious steps within China.
Yeah.
Here, you can't go to work unless you have a doctor's letter and it's confirmed and so on. I know that I know business people who had imported masks, you know, made the masks from China.
People have made money.
The other day, they've sent them back to China because China has run out of masks.
Yes.
China is taking, no one is allowed to go to work in certain areas of China.
They do one.
And even if you have to go to work, there has to be certain permissions done in order for you to be able to do it. So what has happened is China has shut down. Nothing is, not much is working. but they've taken extreme measures.
Let's flip it a bit.
So they are not joking with this issue.
Let's flip it a bit.
We are the ones who are joking.
Gladys, let's flip it a bit.
Let's say
supposing it was Kenya.
Just a moment.
No, just a moment. Supposing it was Kenya, which was going through this, how would China relate with you?
Shut us out.
Please go ahead.
Yeah. So
Now, we'll be slighted. So no flight would be actually getting into China. Right?
Absolutely.
Yes.
Actually, it'd be handled like...
Even goods
like
they would not receive from Kenya.
Yes, yes. Now, not only... Right now, this matter, this issue is on very high priority on the agenda of the AU meeting in Addis Ababa. Because it's not something that you can... For them, they don't care whether you're a Kenyan or a Nigerian or a Somali or a Tanzanian.
They just don't want it in Africa.
For them, you're a black man. Yeah, and if they see this virus manifest itself in one black person, you can rest assured all the blacks in China would have a problem. But not only that, we need to pool our resources together as a continent as soon as possible, because we're the least prepared if this epidemic were to make a landfall in the continent. And I think AU would probably come out with a very powerful statement on this, maybe today or tomorrow, at Addis Ababa. And I think it's for us, and you know, there's always this talk of this population explosion and all these foundations that are running around.
Thank you.
You never know, even if this what you call virus itself was created for purposes of culling the human population, which has exploded now from, in our own lifetime, less than 2 billion to 9 billion now. In my own lifetime, I mean, it was in the late 60s and early 70s, the world population was less than 2 billion.
Right. And
today it's 9 billion. And then China is one of the big places. So
that has remained purely speculative. I think those were the reasons that that has been engineered from a laboratory, which is not true.
No. You see, the more we say in my own language, whenever there's a saying that,
there's fire.
Yeah, whenever there's an issue, it has two things. It's either a problem or it's a blessing. So keep away from the problem. You know what I mean? It might, even if somebody tells you there's a lion coming, and there's no lion coming, and you take your children and your animals somewhere, better be safe than sorry later on. So we can't take a chance as a continent that has gone through the most traumatic thing any human community or any human race could have gone through: slavery, colonization, what used to be done, guinea pigs in the case of the African Americans in the trying them with syphilis and all those things in the early 40s and the late 30s. I mean, we have to be, nobody, as Moise said, nobody cares about the black man. And right now, it's the last frontier. It's the last continent that still is virgin in terms of natural resources, in terms of landmass and everything else. And that's not a nuclear power. You know what I mean? Because then, and that's not in a first world. We don't have a single country from the continent that's in the first world. Every other continent has a country that's in the first world. So we have to worry about our own race, to survive as a race, right, as a black race. And whenever these kind of things happen, our antennas should be way out there, and we should be pulling our...
Well, to sum it up, I think if there is anybody watching this program, the government should not walk on eggshells on this issue. I think what we are demanding as Kenyans is that we need to see extreme measures being put in place. Otherwise, we shouldn't wait to say, oh, we have received two, people have come in from China with this virus, now we want to take these measures. I think by now, we should have maybe an urgent, maybe cabinet meeting, and then some extreme measures should be put in place by the government as a precautionary measure against this virus. Otherwise, I can tell you, in another 2 weeks, you'll have another panel here that will be talking something different, which may be more disastrous for us as a country.
All right. Let's hear from Mohammed finally on it.
Just finally is that what I want us what I want to see is seriousness on the part of government and the part of Kenyans. Have we even looked at the kind of imports that are coming from China and how this could impact on this problem? Are there categories of goods you feel, from the handling to the food itself, that could cause us a problem? Are we really examining our relationship with China thoroughly in view of the seriousness of the problem? I doubt that. And I think at this time, like Sholea has said, government ought to have taken measures that any citizen can see that there is something going on that is dangerous, that we ought to know, that we ought to be concerned. You see, measures ought to be taken that are visible and clear. Because the whole world is prepared for this problem. They may not have the capacity, but in their own small way. And W.H.O. and America, I think a few days ago, is also willing to chip in and help if it's a question of money. But are we showing the seriousness so that even if somebody gave us $1 billion to help us in this, will we not just sit down to eat it? You see, El Nino funds, 15 billion, the rains never came. Where the billions went, you don't know. You know, disaster what? You look at the disaster preparedness. Is this a country that is made up of serious Kenyans? One thing, the bars will wind up.
Yes.
I keep repeating this thing. I hope one day I will be heard. We have to learn to be serious as people. This is the 21st century, for heaven's sake. While you could play around with some disease or something or an outbreak in a place like Marsabit or Vihiga there or wherever, this is a city home to about 5 million people, considering those who transit the city, plying Nairobi and Kiambu and the rest of those places. 4-5 million people in a small area, in a small geographical space. Unless you plan, a calamity occurring will destroy all of us. And I'm not seeing that seriousness. I'm not asking government to do anything. No. I'm just asking government to show seriousness. If you are the minister in charge of health, can Kenyans look at you and get a measure of confidence that the government is in charge? But now when you look at what's going on at Afia, do you have a sense of anything going on? I hope our friend, our panelist here, what is Mutahi Kagwe, I hope he takes over quickly. We see if there's be a change. Honestly, I agree with Sholei. You don't see anything at your level. How about others below you?
Thank you.
It's sad.
It is sad.
And it's tragic.
Right.